This time, in Eye on Yellow Fever, we have a fascinating conversation with a scientist who is taking the fight against disease-carrying mosquitoes into orbit.
We have used the satellite data and Earth observation science together with advanced computer science software to understand how environmental changes and climate change is affecting the migration of mosquitoes and the transmission of mosquito-borne diseases into new areas.
Meet Dr. Charalampos Kontoes.
Satellite data are used along with other information, environmental monitoring networks, meteorological data, and so on, and all of them together making what we call in our science extreme data, big data, for the monitoring of the environment, for the detection of changes in the ecosystems, for the creation of new paths, let's say, for the migration of mosquitoes.
Could this pioneering work set a new standard in tracking and anticipating mosquito-borne diseases like yellow fever?
The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's I for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever.
I'm Maggie Silver from the U.S. Centers for Disease Control and Prevention, one of the Eye Strategy partners. It's great to be with you again. We've heard in previous episodes of Eye on Yellow Fever how global warming is making new areas of the world warmer, more humid, and therefore more hospitable to disease-carrying mosquitoes.
If we were to continue with business as usual emissions, with warming up to 3.7 degrees by the end of the century, then we could see an additional 4.7 billion people being at risk of these mosquito-borne diseases.
Professor Rachel Lowe is a fellow at the London School of Hygiene and Tropical Medicine. We spoke to her back in episode 4, called Public Health and the Climate Crisis.
We're seeing more parts of the globe are environmentally suitable for the mosquitoes to become established and the diseases to spread, particularly in communities that have very little immunity to these diseases. So we need an improved understanding of the potential expansion of these diseases. And we also need to improve our partnerships between vector control teams and climate scientists and policymakers to ensure that areas are prepared to eliminate mosquitoes and protect populations from the spread of these diseases. And this can particularly be done through understanding better connectivity patterns between areas where these diseases are endemic and those areas which don't yet have these diseases but have the environmental suitability for them to become established.
Understanding and tracking how and where new outbreaks might be about to happen is one of the biggest challenges we face. We have recently found that one innovative way to do this could be from orbit via satellite. This episode is a conversation with Dr. Charalampos Kontoes, Research Director of the Beyond Center for Excellence at the National Observatory of Athens in Greece.
Just to give you an idea of the level of the problem, today mosquito-borne diseases as malaria, dengue, yellow fever, Zika, chikungunya are present in more than 100 countries. Each year we account for more than 700,000 deaths because of mosquito-borne diseases. Our focus is on the analysis of big space and in situ data using advanced mathematical and artificial intelligence methods. The aim of the team is to timely transform the data to environmental knowledge and develop user-centric solutions to effectively support decision-making with significant socioeconomic and environmental impact.
Early in 2022, Dr. Kontoes and his team won a €5 million award from the European Innovation Council, the EIC Horizon Prize, for their project EYWA. That's EYWA, the letters pulled from each of the words early and warning. It's exactly that, an early warning system for mosquito-borne diseases, and it hinges on big data collected in part from satellites. Dr. Kontoes started his career using satellite data as a surveying engineer, but it quickly became clear an eye in the sky was useful in all sorts of other fields.
With the advent of advanced computer systems and computer sciences, remote sensing became an umbrella, let's say, an ecosystem of many different scientists. They are joining forces to study the environment and in order to address the needs of various sectors such as agriculture, energy, health, environment, crisis management, disaster management, and so on. This is today my area of expertise.
The system that Dr. Kontoes and colleagues have developed combines advanced modeling of satellite observations with insights from a broad range of other inputs.
The system EUA that won this first prize of the European Innovation Council is using a lot of satellite data, providing a lot of information for the monitoring of the environment, for the changes of the ecosystem. Let's say assessing the changes, the climate, to understand how environmental changes and climate change is affecting the development of the pathogens, the transmission or the migration of mosquitoes, and the transmission of mosquito-borne diseases into new areas.
Can we talk a little bit more in detail about what exactly is possible to monitor using satellites specifically? What can the satellite monitoring tell us?
The satellite products are actually providing information on the changes of the ecosystem. They are providing also information on environmental parameters, on the changes of the vegetation, on the changes of the land use, land cover, and also on the impact the climate change and natural disasters have on the environment. And all these changes, actually, which are dynamic changes on the Earth's surface, are very significant into the development of populations of mosquitoes. In our premises, more than 50,000 satellite images are captured on a daily basis from the whole Earth. And these data are used along with other types of information from in situ networks, meteorological networks, environmental networks, etc., so as to couple this and fuse these types of satellite images and this information in order to have a picture of the changing environment on a daily basis.
And so you're looking at things like flooding or water, sources that might be there, increased vegetation or decreased vegetation for deforestation, to see where mosquito habitats might be, where their host habitats might be, an expansion. Is that correct?
It is indeed that, yes. So by coupling this, by creating relationships of changes on our environment and the landscape, and on the other hand, the quantities, the population, the abundance of mosquitoes, we can create the right relationships on what has been important as a change in the development of mosquitoes, in the development of bigger population of mosquitoes, and also, of course, the increase of the epidemiological risks for diseases caused by mosquitoes.
We'll be back shortly with more from Dr. Harris Kontoes, coordinator of the Early Warning System for Mosquito-Borne Diseases, or EUA. You are listening to the Eye on Yellow Fever podcast from the Global Coalition of Partners working together to end yellow fever epidemics by 2026. If you're new to the series, there are already 11 episodes alongside this one in your podcast player. Please go ahead and give them a listen. Share them with friends or colleagues you think would be interested in learning more about yellow fever or have an interest in infectious diseases. And subscribe so you always get new episodes automatically downloaded whenever they are released. We start the second half of this episode by considering how over the last decade, climate change has brought mosquito-borne disease literally to Dr. Kontoes' doorstep.
Europe in the last years actually has been considered as a hotspot. It was in 2010 in Greece, and sudden outbreak of West Nile virus. Then came to be the same problem in Italy. Also in Italy, we had also the appearance of other type of mosquitoes, which is responsible for the West Nile virus, but also mosquitoes like Aedes aegypti that are responsible for dengue and yellow fever. Even in northern Germany in 2021, because of big flooding events along the Rhine River, we had such big concentration and development of mosquito populations that even our models could not exactly, or let's say, accurately assess. Because it was an extreme case, and our models were not actually trained to provide information of such big, let's say, outbreak of mosquito population. And this happened in northern Germany. Of course, with the increase of mosquito population comes the outbreak of diseases. So therefore, it was initiated, this action actually by the European Commission asking us to provide a decision support system which is providing in a timely manner information about what is to be expected in short term, but also in longer term about the abundance of mosquitoes, the expected populations of different types of mosquitoes, and the epidemiological risk which is relating to this species of mosquitoes.
The AOS system also pulls in, for example, socioeconomic data, allowing scientists to factor into their response planning risk of serious illness or widespread outbreaks. It's a huge range of data from multiple disparate sources.
Information relating to migration, to occupational data. There is a lot of information which is actually ingested into our models for making these proper relationships between environment and mosquitoes.
Can you just talk a little bit more about the process of this? How do you go about pulling in all of those pieces and working with the different groups that have that information?
Yes, this is a very, 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 very important question. And this actually is the core part of EWA and what EWA really is providing. Actually, we have 5 European countries from Greece, Germany, France, Italy, and Serbia, 10 regions in those 5 countries that are receiving services from the EWA system. At the same time, other countries and key institutions like WHO, the Joint Research Center of the European Commission, the Civil Protection and Crisis Management Center of the European Commission, and several other international organizations such as the Robert Koch Institute, the Vector Control Research Center of India, and other similar organizations in Brazil, Mexico, etc. Several of them are providing us data. Data is very important because most of our models are artificial intelligence and machine learning models, so we need a lot of data so as to create the right relationships between environmental conditions and mosquitoes and pathogens transmission and so on. But at the same time, they are providing us expertise. They teach us how they want to get the information, how early, how often, and in which accuracy, and under which standard. And this is, of course, something that has helped a lot. And I have to tell you now that the EWA system is not just the fruit of the group of scientists that came together and developed this system. It is the fruit of a co-design process, the outcome of scientists together with users, together with stakeholders.
We talk a lot on Eye on Yellow Fever about the importance of early detection of disease in order to minimize any outbreak. It's why Eye, for example, focuses on speeding up response times of laboratory tests and facilitating rapid outbreak responses close to the source. Dr. Kontoes' early warning system takes that a stage further, using big data to predict a disease outbreak even before it started.
Knowing in advance, let's say 1 month before, which are the settlements and villages that are at high risk, the authorities initiate and undertake targeted actions, awareness actions, citizen awareness actions by paying visits, door-to-door visits to the citizens in those areas. So this, as you can understand, this is something very important. It is actually providing a mosquito control plan which is very well optimized early enough.
Who is benefiting from this, or who do you hope to benefit from this on a broader scale beyond the 5 European countries that you've been working with?
Okay, yes. Of course, although we started by developing and deploying the system at the European Union scale, which of course is something that we continue doing by engaging more countries, because as I mentioned before, for the time being we have 5 European countries, but these are not the only ones that are suffering from mosquitoes and mosquito-borne diseases.
EWA is also beginning to be made available to some countries in Africa and Asia. Dr. Kontoes says further rollout could soon be possible to countries where quality data can be made available.
Now we have focused in specific regions of the Ivory Coast and in Thailand. actually to adapt the existing models of AOA into their territories and provide the same type of information like we do for Europe in those countries. The AOA system and the models as such are created so as to be scalable and transferable to other areas. And this has been already proved by the implementation of the system in different regions, different scales, different climatic zones, the scalability, this transferability of the system and its openness actually to different landscape and regions are actually the characteristics of the system that make us believing that we can transfer it and we can use it in other territories and not only the ones that it is currently used.
What else is in AOA's future? Well, Dr. Kontoes says it will benefit from integrating yet more and different types of data. He wants to build on areas around increasing globalization and urbanization. Two more things we talk about a lot in this series as big risk factors for yellow fever.
Factors that affect significantly the migration, actually. They facilitate mosquitoes to finding paths from one continent to the other, from one country to the other. It is indeed very important for the future to take also into consideration this type of data.
But the ongoing big challenge is finding places where quality data of that type can be reliably sourced.
We have initiated finding out specific databases from some organizations that are keeping records of migration of people, of workers, of data on the various occupational environments that are mostly vulnerable and affected by mosquitoes and mosquito diseases outbreaks. But these data are not yet kept in the right way, in a systematic way, so as to be integrated in the models.
Well, your work is certainly remarkable, and I think just having a globalized system, I know how incredibly helpful that would be for all of our jurisdictions. I really look forward to seeing how this grows and takes shape. So thank you so much.
Thank you very much indeed. Thank you for giving me the opportunity to provide you with this information about the EWA system.
It's been so fascinating to hear about Dr. Kontoes' research. An important reminder before we leave you that word of mouth is so important when it comes to reaching new audiences with podcasts. So if you have colleagues or friends who you think would find this episode useful or interesting, please let them know about us by sending them a link. You can select subscribe or follow to make sure that all future episodes of Eye on Yellow Fever are automatically downloaded direct to your device. Also, we would love for you to leave us a review in your podcast player. What are we doing well? What would you like us to do more of in the future? This episode was produced by Dave Howard with research from Amelia Jansen and sound design by Adam Whaley. I'm Maggie Silver. Eye on Yellow Fever is a Bengo media production for the Eliminate Yellow Fever Epidemic Strategy.